ask you a further question. Given now that a lot of us, we can Google, we have a little bit more idea about healthcare, about how doctors
Right.
operate, let's say 10, 20 years ago. I'm curious to know, how does pediatrics as a science or as a subject, how is it different than, let's say, a normal practitioner or a general practitioner? How do you look at things differently? Of course, I know there are so many details. From an overview perspective, if a layman wants to understand, how is pediatrics different than, let's say, a general practitioner?
Pediatrics is different, firstly, because your patients can't really articulate well. So many people really do not want to take up pediatrics because they think it's really, and the children will be crying, they'll be howling. It's anyway so difficult to come to a diagnosis. Plus, if you don't get accurate history, you don't get a cooperative patient, things become very difficult. But I think for me, it is a challenge that I want to take up because I find them so pure and so innocent that even that kind of interaction, it's good for me. I get joy out of it.
Um,
Plus, children usually don't have a very chronic history. I mean, a chronic disease as compared to adults. For example, if a 30-year-old or 40-year-old comes to me, he'll have a long series of mental and physical changes, which are very difficult to treat actually, because to undo all those years of damage for
mm,
whatever reason, nature or environmental or personal, it's very challenging. But for children, because it's such a short duration and everything gets amplified in their case because they can't talk, for everything they'll have a reaction which the parent notices and brings it to the doctor. So I find it very rewarding. You don't have to, you give them a few medicines, make a few changes, and they come back to normal. So I find that pretty rewarding. Yeah. And I like to see them happy. When the child comes to you with a very sick face, you just do a little teeny weeny magic, and then the response is like a big wide grin, which is very difficult to elicit from adults.
Most adults are walking with such a big frown, even if
Yeah.
they won the lottery. Wow, that's such a beautiful point, and um, I love that you mentioned how uh, I never thought about this, how it can be to be a doctor and try to treat the patient without actually getting to know what the problem is, and like try to figure it out through gestures and through reactions. Wow, that's a challenging job. A lot of communication is involved. Communication skill is involved in reading the body language and tonality,
Right.
I believe.
Right.
Wow. Is there like a specific communication training that you go through, or some things that you have picked up over the years, like knowing that, oh, if the child does this, like certain formulas or principles in your mind?
Picked up over the years with experience, and it's a lot of acute observation.
Hmm.
So,
What's an
yeah.
example? Like, I'm curious to know if there's a certain example that you can share with us.
So for example, what can I say? So for example, if a child comes to you, a baby, so a newborn, especially with a newborn, you get absolutely no history. But then if you do the head to toe examination, there are a lot of signs that you have to pick. And it's more like an analysis you do when after collecting all the signs.
Hmm.
So if it's a certain combination, you reach to this diagnosis. If it's a particular set of combination, you reach another diagnosis. It's like that. But because it's so there, I mean, the proof is there in front of your eyes, and there's no concoction. I mean, they cannot manipulate. With adults, what they do is a lot of the history and the complaints is also a part of their bias that they have. And
Hmm.
it's, they choose to tell you some things, they'll choose to keep away some things, all those things. It doesn't happen with children. What you see is what you get. And so it's, in a way, it's much simpler for people who are oriented like that.